Osteoarthritis is a wear and tear disease. Rheumatoid arthritis, not quite as common as it used to be. We have so many new medications that help control it. And post-traumatic arthritis, usually due to some sort of injury. If you look here, this is the cartilage on the end of the bone. When that cartilage wears away, as you can see in this picture, that's arthritis. So most people ask me, can you just go in and take out the arthritis? And the answer is, well, no, because arthritis is the absence of something, so you can't go take out nothing when it's already missing, okay? And then the other thing that people ask me all the time is that when you have a joint replacement, is the arthritis gone, or is it possible to leave some in? But when we replace a joint, and this is a knee, we're essentially cutting off the end of the bone. And so we're getting rid of the surface that was covered in cartilage and we're replacing it with metal and plastic. And in that case, you can't have arthritis because you've gotten rid of the area where arthritis occurred.